So the topic for today is pre-construction infection risk assessment, and this is the scheme of presentation. And I discussed various elements that are included here: the construction and renovation issues that we need to look at, events that cause contamination, what are the at-risk activities, or what are the at-risk categories of patients who need to be, about whom we need to be concerned. What are the sources of infection, and then we will look at the guidelines for preventive measures, and then the assessment tool itself. Though the topic is assessment tool, but we will look at the background before we go to the tool itself. This we talked. So serious health risks are associated or are created when there is a construction activity. And when we say construction, we include all renovations, maintenance, repurposing, and remodeling or remediation activities. So a remediation example will be when you want to correct the seepage in a wall in the patient care areas, or you are rewiring or correcting the electrical lines or medical gas pipeline lines, etc. Then completing the infection control risk assessment by the construction planning team is essential. So we are beginning with this point. There is little scope for justification or why should we do this. We are beginning that this is essential, and a team is required. So the components of or the constituents of the team will be people from the infection control, your infection control organization or the setup in your hospital. Typically, infection control officer is the one who's involved here. You will have people from the facility maintenance, from the administration. So if you have someone from the project management who is handling this entire construction project, as well as the contractors. In addition, you should also include the healthcare workers, the doctors or the senior nurses who are part of the area where this particular activity is going on. So if you have operation theatre or the OT involved, please speak to the doctors concerned and also the clinicians concerned, because eventually their work is affected. Their protocols will need to take into account the contamination that will be caused by the construction activities. And I've already said that modification of a facility or an area with the intent to repurpose is also included in the definition of construction. So these are some of the factors that cause contamination, and the first one is inadequate preparation and quality control. This may be to do with the construction activity itself or to do with the patient care activities. Inadequate or uncontrolled ventilation, then containment of construction activities. So you are not, regulating movement of the laborers and the workmen who are working there. Inadequate storage of construction materials. This is something all of us have seen, the bricks and the sand and the whole lot of material lying all around. Disturbance of the existing contaminated materials. For example, when you take out the soil, when you are removing the tiles, when you are demolishing a part of the structure or breaking part of the structure, then these debris that comes out has to be handled in a certain manner. Penetration of the construction material by water and resultant stagnation. This is again a common issue leading to seepages. So when you have construction going on the upper floor, the lower floor, lots of times they face this seepage and the moisture coming into the patient care areas. And this moisture will lead to many other problems that we will see during the course of this presentation. Further, repair and modification or accidental incursions into the water pipelines. This happens commonly. You break open a particular part of the wall and inadvertently or maybe by design, the plumbing has to be removed or disconnected or broken. Contaminated material brought onto the construction site. Again, this is something that happens all the time. So you have removed part of the flooring or part of the wall, and this is lying around the construction site. And if you have not contained it well, then this will become a factor. Stagnant standing water on the construction site, again, not uncommon, and it is also a cause for concern. Entry of pests. typically in our hospitals, we have stringent measures to control the pests in the hospital. So we have pest control, person visiting every fortnight, every month. You have measures for rodents control, for cockroaches, insects. But when the construction happens, a lot of these control measures or the barriers that we have created are broken, and therefore the entry of pests is something that happens. Inadequate cleanup and the sanitation procedures. So whenever there is a disruption in the normal routine, the first thing that will be affected is your housekeeping and the sanitation, and that will have its implications. Is my voice audible?
Yes.
Yeah.
Audible, sir.
And you can see the presentation as well.
Yes.
Okay, so that's a consolation. Great, for me at least. So, what are the events that cause contamination? We will consider some of the examples that happen during construction activity. Again, nothing really new, common sense items, but we need to list them. So, whenever there is a soil excavation, whether it is happening inside the healthcare facility or if it is happening outside the healthcare facility, for both circumstances, it will affect because it generates dust. And most often, in fact, almost every time this happens, the dust that is generated is contaminated dust because it is contaminated by the fecal matters, it is contaminated by a wide range of contaminants, and therefore this is a cause for concern. Then the soil excavation also leading to contamination of the water supply. That's also happens when you disrupt the plumbing lines or the drainage lines. HVAC system, this is when the HVAC systems, the exhaust grills or the air intakes are not covered properly during the construction. You have, for example, if you are maintaining the air filters, you have taken out the microwave filter or the other filters from the HVAC system. Even this activity of maintenance qualifies as a construction for the purpose of infection control. So therefore, what are the measures we take while we are trying to change or repair or clean these filters? Many of you who may have attended the session on post-pandemic operationalization of healthcare facilities, we had covered there that the cleaning or maintenance or replacement of HEPA filters and all other air filters in the HVAC system from the isolation facilities where you have treated COVID patient is something that needs to be done with lots of care. You need to have this maintenance staff wearing full PPE because they will be exposed to all all that was stopped by those filters. So therefore, this becomes an important aspect. Demolition of ducts when we are extending the HVAC system or when we are maintaining the air conditioning system, that is where this happens. Improper ventilation of exhaust systems, failure to maintain air filters, inappropriate use of permanent ducts to move HVAC filtered air during construction. So when you have one part of the hospital under construction, we either seal off that portion, block the air conditioning or the HVAC system duct, and then we reroute the air conditioning duct. So when we do this, we need to be very sure from where the air is being taken and from the air is being to where the air is being supplied. So this is an important aspect because air quality will be adversely affected if we don't look at it. Next is windows. Nothing really great, but just to complete our listing, construction or demolition near open or improperly sealed windows will cause the dust coming into it. Will also cause the pests or the worms or the cockroaches. A whole lot of, basically, you open a vista through which these elements can come in. Window air conditioning facing road construction activity. Very common. We have lots of hospitals which are on the roadside. There is hardly any distance from the road and to the hospital buildings. When you have a window air conditioning and when you have opened the exhaust of the window air conditioning you opened it for fresh air. This is also bringing in all that is outside the roof. A disturbance of dust while working on the window blinds. Well, this is a routine maintenance activities, and the dust that is generated is something that needs to be covered. So the method typically is to use a vacuum cleaner so that you don't unsettle the dust too much. The next is failure of moisture barriers. Now, this can happen, as a temporary event where you have the roofs being repaired and therefore there will be a seepage leakage. It may also affect your walls, and when this happens, this will be the cause for the moisture coming into the patient care areas and the resulting into fungus growth and many other issues in the patient care areas. So therefore, this is a part. The next one is a miscellaneous listing. So we have carpets, we have construction dust that contaminates the patient care supplies. In any case, we have lots of dust that contaminates patient care supplies if our housekeeping systems are not good. I can invite you to walk into the medical stores of your own hospital and see the amount of dust that is there. It is there in all the hospitals. It is there in the hospitals where I have worked. But once we are conscious of this, then we make an attempt to address it. Similarly, the elevator shaft is an issue. This is an area which is mostly out of sight, and therefore maintenance activities do not take place that often. Construction near the high-risk patients, so you have the ICUs or the isolation rooms or the operation theaters. So wherever you have high-risk patients or high-risk areas, if the construction happens near that, we need to be concerned. Disturbance or removal of ceiling tiles, disturbance of contaminated wall coverings, dust barriers, whether if they are not erected before construction. A lot of times you might have seen that a part of the hospital premises where the construction is going on is blocked by temporary blockage. So you use wood boards or the sheets or metal sheetings for blocking those areas. So the idea is that the disturbance to the patient care areas should not happen. Further into the list, we have dust from ceiling tiles contaminating the microbiological plates, resulting in having the adverse effect on the culture and therefore the diagnosis. Nearby construction sites, the construction work contaminating the isolation rooms if we do not have a proper isolation. Food particles in the wall cavities. Very often in the kitchen you have this issue, and this needs to be addressed. Removal of glass wool. We use glass wool for insulation, and when it is being removed or replaced or being maintained or if that space is open for any purpose, that is the time we need to be aware of it. And water supply depressurizes. Typically, water is obviously supplied at the pressure, and therefore you can take it from the taps. But when the lines depressurize during the times when the supply is disrupted, or when you have booster pumps installed on the plumbing, so whenever the pump operates, it creates or depressurizes the supply line, and if there is a breach in the line, it will bring in just about everything that is outside. So having a booster pump on the plumbing line is not a good idea, even though a lot of places, especially in cities and the urban settings where the supply is an issue, this is used. So when we use this, we should be aware that this will also lead to contamination of water supply. So as a broad classification and as examples, these are some of the at-risk services and the patient categories who will be adversely affected. So we have all the patient care facilities where we keep immunocompromised patients. So whether it is a bone marrow, the solid organ transplantation areas, the chemotherapy wards, the places where the HIV/AIDS patients are kept, or any patient who has a compromised immune system. The second category will be people who have a compromised immune system for pre-existing comorbidity. So this could be patients with renal failure, diabetes, which is complicated, chronic lung disease, chronic heart disease, cancers. Then we have another category where the patient may be prone to infection. So just because he's undergone a surgical or invasive medical procedure, and then the extremes of age is a vulnerable category in any case. So newborns and the elderly. So these are some of the categories. You can have more categories, but the idea is to realize that the kind of patients who will be adversely affected because of the construction happening and leading to infection risk. As far as the construction activities are concerned, two classes of infectious agents are common, fungus and bacteria, and these are some of the examples I've given in the slide. I will also share this presentation so you can look at them in more details. I'm not going to read out the entire list, but we have bacteria and the fungus commonly responsible for. A large number of allergens are also found in the environment, and when construction happens, these find way into the healthcare facilities, and obviously will have problems. So what are the guidelines? Now, these guidelines are based on a document that is available as a resource material from the Joint Commission International. So that I will also be sharing that document. I'm just listing all the guidelines that they have set. So include the infection control, infection prevention and control, that is the expanded form of abbreviation IPC. So include IPC personnel in the project planning team. I've already covered that in the beginning. Perform and document infection control risk assessment and the preventive measures analysis. We will see what it is. So when we look at the tool, for new constructions and for contracted renovations, complete the infection control risk assessment and the preventive measures analysis by a designated member of the planning team. So this is something that needs to be done prior to the start of activities. Situations that pose risk to patients and staff must be reported immediately. Now, this will happen when the construction is or the activity is going on, and if a healthcare provider or a doctor or a nurse or someone identifies a situation that poses a risk, that must be reported. Notify for all work affecting populations at risk. So whenever you are, let's say the example for this is you have an intensive care unit, the ICU or the HDU, and some work has to take place near it or just outside the ICU or on a system that is supplying the ICU. Obviously, you will have to tell the staff and people in charge in the ICU that such and such thing is happening or is going to happen. And also, then they will need to take measures to whatever are appropriate. Documented the infection control risk assessment and its review by the members of the planning team. So it is not a one-time activity that we have done the risk assessment and then we file it and forget about it. It has to be reviewed by the planning team whenever the situation demands, and that will happen fairly often when there is a large construction project going on or a renovation project in the hospital. Include this in the tendering document. So when you have the infection control risk assessment and the preventive measures analysis included in your tender document, then your contractor is bound by the conditions of the tender, and therefore he will be bound to implement measures that you have recommended in your preventive measures analysis. Documented plan for meeting the required preventive measures analysis to be completed and reviewed by the planning team. It is same as the risk assessment. It must be done prior to start of work. And the preventive measures analysis has to be implemented and monitored. Now the planning team members will monitor it, and there is a documented monitoring plan is required. Now this particular requirement is classic for just about any quality activity that you may have seen. So those of you who are in a hospital which is accredited either by RFHHA or JCI or any accreditation organization, you would have realized that whenever an action is required to be planned or is a certain line of certain process is required to be implemented, the first and foremost requirement is defining it and documenting it. Similarly, the preventive maintenance activities or the analysis has to be documented. Otherwise, you will have no reference point when you start to monitor it for day-to-day infection control measures. Then documented protocol for stop work order to be identified prior to start of work. Now, whenever you create a noise and when you say that the work has to stop, there will be a lot of commotion. There will be a lot of issues because the contractor has lined up all the construction material, the labor, and all that. And suddenly, one fine morning, you take a round of that area, inspect that area, and you come up with an idea, the work has to stop. Why? Because certain activity has not been done properly. Now, this is something that will create a lot of issues within the organization because obviously the contractor ends up losing money. Your project timelines will get delayed, and therefore, within the preventive measures analysis and as a follow-up of the infection control risk assessment, what will be the protocol to stop work? Who will take a decision? What are the likely triggers based on which the decision will be taken, and how it will be communicated needs to be defined, and it will be a good idea to include it in the tender documents as well, so that when you order or when your administrative authority orders stopping of work, then it is in line with what was already terms of reference in the tender document. This is a difficult area in the projects that I have handled in past. In fact, 2 very large projects that I have handled. This was something that needed to be done often because obviously in an effort to save costs, the contractors will get into many activities where they will cross paths with the infection control requirements, and then you end up in a situation where work must be deferred or rescheduled or stopped. So a protocol must be in place as to what will be the triggers, who will take a decision, and in what manner it will be enforced on the contractor. Because if you don't define it, then obviously there will be major issues at the time when you want to do this. Infection prevention and control education plan for staff. This can be part of your routine infection control training that you carry out in the hospital. And large hospitals will need to have need to include this in their regular infection control training, because this is something that will happen in some part of the hospital or the other. Now let us look at the assessment tool. Any issues or any questions so far? I hope my voice is audible.
Yes.
Yes, sir.
Okay. So let's look at the assessment tool itself. This is the pre-construction infection risk assessment tool, and it is made up of 14 steps. We will look at all the steps. It is important to know the steps, and you will realize that many of these steps are a logical follow-up from the preceding steps. So there's nothing really too much to remember. But as a presentation, we need to look at the 14 steps. So the first one is to figure out what kind or what type of activity that we are looking at. The activities are divided into 4 types, type A, B, C, and D. Type A activity will be where there is inspection or there are non-invasive activities. And it includes, some of the examples are removing the ceiling tiles for visual inspection only, and you are not getting into any repair, replacement, or something of that sort. Now please see that the tool also defines as to how many tiles are removed to qualify as type A activity. So 1 tile per 50 square feet, I mean, we may possibly need not go into so much of micro detailing. However, it is important to understand that type A activities are those which are inspecting kind of activities or which are non-invasive. So you're not breaking anything, you are not removing part of the structures, you are doing something non-invasive in nature. So you are removing a couple of tiles just to inspect. You are possibly redoing the painting. You are inspecting the wall coverings or the electrical work or the minor plumbing issues, replacements of taps and all, which is fine. So that comes to type A activity. Type B activities are those which are small scale, short duration activities that create minimum dust. So some of the examples are, when you are installing cabling or when you are doing the concealed wiring, those activities, access to certain spaces, for example, drainage spaces or the lines when you are repairing, cutting off walls and ceilings where the dust migration can be controlled. So you can, you are doing a very localized activity in just one part of the wall or ceiling, and you can control the dust in that area. That will qualify as the type B activity. Type C activities will be where the work generates moderate to high level of dust. Many examples are here. So when you are undertaking painting or whitewashing or such activities on the wall, and you are removing the previous layer of paint, or you are scrubbing it, or you are sanding the walls, that will qualify as the type C. And the other examples are also given. Similarly, escalating. So type D is a major demolition and construction projects where you actually get into excavations, breaking down a certain part of the building or a wall, and activities that involve complete heavy demolition or complete plumbing system is removed, or significant portion is removed, or cabling is removed, like that. So the first element is to figure out what type of activities we are undertaking. The next is to identify the patient risk group, and the patient risk group is in 4 categories. It is low, medium, high, and highest risk. So low risk areas are the office areas. The medium risk areas are these, essentially some of the examples that are given here: cardiology, echocardiography, endoscopy, nuclear medicine, physical therapy, like that, where you are not undertaking any invasive procedures in that sense. High risk areas are those: the critical care units, the emergency rooms, the labor or delivery units, laboratories, medical wards, newborn nurseries, outpatient surgeries, or the daycare surgery areas. And the highest risk areas are areas where the immunocompromised patients are being treated or being cared for, the burn units, the cath labs, the operation theaters, and you can actually make a long list of items here. So this is, the first one was the type of activity, the second one is the patient risk group. Now these two put together gives you a matrix. So let us look at the matrix. So we match this patient risk groups with the construction project types. So here we have type A, B, C, and D as far as the construction type is concerned, and the low, medium, high, and highest is the patient risk group. So if you look at this table, you will see that it is you have the Roman numbers here. So 1, 2, 3, and 4, and these Roman numbers give you the what is called the class of infection control precautions. So we have 4 classes of infection control precautions, and they will be implemented depending on the patient risk group and the construction type. Now, this is the description of what all activities will take place in infection control precautions by class. So class 1, class 2, class 3, and class 4. And these 4 classes are divided into 2 vertical columns. One is during the construction, and the second one is after the construction. I'm not going to read this out since it is there in the document that I'll be sharing. But just to understand the concept, if you look at class 1 activities before the construction. So it says that execute work using methods to minimize raising the dust from the construction operations. Immediately replace a ceiling tile displaced for visual inspection. So this is infection control precaution that must be taken, that if you have taken out a tile for inspection, immediately replace it. Don't leave it open. Similarly, after the activity is over, so area must be cleaned. So this is a class 1 infection control precaution, very simple activity, but nonetheless it is required to be carried out. When it comes to class 2, which is the next level, so you have during the construction project, you have to provide active means to prevent airborne dust from dispersing into the atmosphere. So this can be by putting the dust barriers, by sprinkling water to reduce the overall quantity of dust, using water mist work surfaces to control the dust while cutting. So there are multiple activities which are, multiple precautions which are listed here. Similarly, the precautions that are required to be implemented after the activity, the construction is over. So this is class 2. Similarly, we have class 3 and class 4. So this is class 4, and class 4 is is a longer list of infection control precautions. So it spills over into two slides. It is where it begins. So just to look at an example, so when you have class 1 infection control precautions, the first one is isolate the HVAC system in the area where the construction is being done to prevent contamination of the dust system. And like that, it continues. There are 6 precautions which are listed to be implemented during the project, and upon completion, there are 7 of them. So what should be done, how it should be implemented is defined in the class of infection control precaution. So 3 things we have figured out so far. One is the type of activity. The second one is the patient risk that is there. So what kind of patients you have, and then a matrix that gives you a class of infection control precautions. The next one is to identify the surrounding area. This is as important. So not only the area where the construction is going on, but also the surrounding area. So we need to figure out what is below that area. So if the construction is going on in the 2nd floor, what is in the 1st floor, just below the construction area, what is just above, what is on the 2 sides of it, and what is behind and what is in front. Essentially on all sides, what all exists, and what is the risk group for those areas, and what class of infection control precautions will be required for those areas. So this is step 4. Step 5 to 11 are essentially sequence of events or activities that need to be done, mostly by the planning team. So we have to identify the site where exactly this activity is going to take place. We have to identify the issues related to HVAC, plumbing, and the electrical outages. Needless to say, when you get into a construction project, obviously you have to shut down plumbing or the electrical or the HVAC systems, and how it is going to affect the patient care needs to be seen. Identify containment measures. So you may need to build barriers. So you block corridors or you block windows using the temporary sheetings or walls or wooden planks. Or you may institute additional filtration measures. For example, put a HEPA system in the HEPA filter in the HVAC system. Consider risks of water damage, and this will happen from moisture seeping into the wall or into the area, or it can also happen because of flooding, which happens fairly often. Like that, you look at all the next step, that we restrict the construction during certain hours only, if at all it is possible. If not possible, do we shift the patient care? Verify the adequacy of isolation rooms, important, especially when we anticipate that the COVID might require isolation rooms. Ensure the adequate hand washing facilities. So when you shut down plumbing, your hand washing is no longer available to you. So what is the alternative being provided? Confirm if the infection control team agrees with the hand washing facilities that are being made available during the construction. Now you would see that there are 2-3 steps related to hand washing itself, because hand washing is considered one of the most important infection control intervention in the hospitals. So we are, the step number 11 was that we look at, we ensure adequate hand washing facilities. The step 12 is that the infection control team of your hospital or the hospital infection control committee must agree with what is the revised hand washing facilities being provided in that area, and check if the infection control team agrees, or if your HICC, the infection control committee, agrees with the plans for utility areas. So clean areas and the dirty utility both have to be addressed properly. And lastly, uh, you must have a plan, and this will be done by the team as to what will be the traffic movement. So, movement of patients, movement of material, the construction material, movement of construction workers, how the housekeeping will take place, and how the debris will be removed, at what frequency. If it is going to interfere with your day-to-day hospital work, then you have to have these debris removed very frequently so that it doesn't accumulate. So these are the 14 steps. I have completed the presentation. If there are questions, we'll address them. And like every time I mention, what are the downloads being provided? So this presentation will be available, and the JCI resource, which is the primary source for the presentation today, will be available. I have finished. If there are questions, I'll be happy to take. Thank you very much. So, are there any questions? Is my voice audible? Is my voice audible? Yes, Dr. Subramanian. Okay, so the topic is fairly simple, but we just needed to, we needed to understand the tool, and we needed to channelize our thought as to how this needs to be implemented. That was the reason it was listed as the topic for our live. Another reason is also that in our hospitals, we sometimes do not pay adequate attention to it, and that's the reason why we are looking at it. So thank you very much. If there are no questions, then today's presentation is over. We meet next Saturday on 9th. Following that is on 16th of October, there will be no session. I have also mentioned it in the email that is being circulated for the forthcoming sessions. That's because of Dashera or Vijayadashmi, which is on, I think, 15th. So immediately following that festival, there will be a break for staff here also, and for everyone else as well. So 16th October we are not meeting, but next weekend we are meeting, and that's the 9th of October we have another topic. Thank you very much, and all the best.